Good morning, ladies and gentlemen. I am Alper Murat Ulaşlı. I'm a physical medicine rehabilitation specialist working for Lokman Hekim University in Ankara, Turkey. Today, I would like to talk about regenerative treatment modalities for musculoskeletal diseases, which is nowadays a hot topic. Starting with PRP in the late 80s, there has been a paramount growing in the regenerative medicine field. Currently, the researchers are actively exploring the use of growth factors, genes, stem cells, exosomes, microRNAs, and biomaterials, alone or in combination, in order to enhance healing. The field of regenerative medicine is relatively new, but it's expanding rapidly. Also, the published papers in this field has a rapid increase, as you see here. Me and my colleagues also have some papers about this field in regenerative medicine. So the question is, why should we use, or do we need to use regenerative treatment modalities in our daily lives, in our daily practice? At the beginning, the regenerative treatment modalities started as an alternative or supportive treatment method for conventional treatments. But now, as we use injectable biologics in a wide spectrum of diseases, we are discussing the evidence to use or not, or in which stage of the disease we should use. Everybody experienced in orthopedics or physical medicine know that conventionally we use steroids and local anesthetics for treatment of joint and disease or tendon problems in the past. But the research showed us that although the steroids have strong anti-inflammatory effects, they are also harmful for living cells, I mean tendon cells, cartilage cells. The PDGF, which is platelet-derived growth factor, is shown here in this study to reverse, at least partially, this harmful effect. And what about we use the local anesthetics and steroids together? It's worse. They synergistically have deleterious effect here on tenocyte culture cells. So, are we in a dead end? No. Nowadays, we have numerous studies, and ongoing ones, in regards to the effect of the platelet-rich plasma and bone marrow aspirate concentrate and adipose tissue-derived products in a wide spectrum of diseases, including lateral epicondylitis, rotator cuff tendinopathy, plantar fasciitis, Achilles tendinopathy, facet joint arthropathy, non-unions or fractures, osteochondral lesions, and osteoarthritis, but the indications are not limited with these problems. Here you can see the use of adipose tissue biological products, I mean microfragmented fat, nanofat, and stromal vascular fraction in a wide spectrum of diseases. In almost all studies, the pain of the patients is reduced and the function is improved. So we have many reasons to use biocellular therapy. There are various kinds of biocellular therapy in daily routine we use. Starting with whole blood therapy, autologous conditions plasma, platelet-rich plasma, platelet-rich fibrin, and rich in growth factors, concentrated growth factors, bone marrow aspirate concentrate, adipose tissue autograft, including nanofat, microfat, and stromal vascular fraction, amniotic cell concentrate, umbilical cord derived stem cells, mesenchymal stem cells, exosomes, and nowadays human very small embryonic-like stem cells. The ones on this side are easily obtained without any further manipulation. We can obtain these biocellular products with minimal manipulation to complete regulatory issues. But on this side, Again, nanofat and microfragmented fat can be obtained in completely interfering with regulations. But if you use enzyme to obtain small vascular fraction, you must obtain a permission from regulatory institutions. So in our daily routine, because they are cheap and they are easily obtained and prepared rapidly, we prefer to use the ones in the left column, small vascular fraction, which is mechanically prepared and nanofat. The focus of regenerative medicine is human stem cells. There are various kinds of stem cells, adult stem cells, embryonic stem cells, and induced pluripotent stem cells, which won the Nobel Prize in 2012. The embryonic stem cells, the use of these cells are not allowed in most of countries. So the bone marrow-derived mesenchymal stem cells and adipose-derived mesenchymal stem cell are two sources we use mostly. Stem cells are classified into different cell types, starting with totipotent stem cells and going with pluripotent embryonic stem cells. These two are not allowed to use in clinical routine. But we can use multipotent stem cells, including mesenchymal stem cells, neural stem cells, and hematopoietic stem cells. This picture is from one of our ongoing studies. Mesenchymal stem cells are also called mesenchymal stromal cells, medicinal synaptic cells. They have fibroblastic-like morphology. They have low immunogenicity. They have anti-inflammatory, anti-apoptotic, antibiotic, and immunomodulatory effects. These cells are multipotent, which means they can self-replicate, proliferate, but also have potential to differentiate into different cell types, including osteocytes, chondrocytes, smooth muscles, and skeletal muscles, and tenocytes, and also adipocytes. But if you provide certain conditions for these cells, besides they differentiate to mesodermal lineage, including adipocytes, chondrocytes, and osteoblasts, they can also differentiate to hepatocyte, liver cells, pancreas cells, neurons, and skin cells too. So what happens if we inject mesenchymal stem cells into a joint? They secrete various kinds of exosomes, and they regulate cell differentiation. They release cytokines. They induce cartilage regeneration and suppress cartilage degeneration. They act like a drugstore and support the natural healing process of the home tissue. They have anabolic effects and anti-catabolic effects and immune modulation effects. And what's the optimal source of these cells? It must be easy to get. It must reveal high quantity of cells with minimum morbidity. These cells should be multipotent and should proliferate to different cell groups, and it must be safe after implantation. So, bone marrow and adipose tissue are two common sources we use in daily routine. Starting with bone marrow-derived biocellular products. Bone marrow includes mesenchymal stem cells, hematopoietic stem cells, but besides, the bone marrow includes very important cells too, like Muse cells, which act like embryonic stem cells in the organism. The pericytes, the other important cell, they can act like mesenchymal stem cells, and endothelial regenerative cells work in vasculogenesis of the tissue. The stem cells are resided in subchondral bone and perisinusoidal regions of the bone. If the patient is awake in my clinical routine, I usually perform my bone marrow aspiration using ultrasound guidance here. But also during a surgery, if the patient is under general anesthesia, you might not need a guidance. You can palpate or make a small cut and can see the bone you target. After filtration and activation, we can obtain two major kinds of bone marrow aspirate products. The one is bone marrow aspirate concentrate here. The other is bone marrow matrix, which has a 3D shape and can be used for special purposes. And we continue with adipose tissue-derived biocellular products. The adipose tissue is an abundant source of mesenchymal stem cells, but not only mesenchymal stem cells. Besides mesenchymal stem cells, they include pericytes and endothelial progenitor cells, hematopoietic stem cells, and the others. These two cell lines are very important for tissue healing. For harvesting adipose tissue, mesenchymal stem cells from adipose tissue, we use local anesthetics. And in case we need ultrasound guidance, we check the thickness of the fat tissue, we target to aspirate. The adipose tissue may be processed to produce small portions for the purposes for performing a fat graft or lipotransfer. Here you can see stromal vascular fraction, including only cell lines. This is nanofat. It has a size less than 1 millimeter, and these stromal cell aggregates have a size over 1 millimeter. The SVF contains adipose stromal cells, endothelial cells, pericytes, fibroblasts, monocytes, and adipose-derived mesenchymal stem cells. It's a heterogeneous cell population. After lipoaspiration and centrifugation, we obtain this 3-layer biocellular product. And we use special blades to microfragment the adipose tissue. And at the end of this processing, we can obtain two kinds of final product. The one is nanofat, the other is stromal vascular fraction. Both of them can be used for regenerative purposes. We use ultrasound guidance for most of the joints for regenerative injections, and also one can inject biocellular material blindly, for example, for knee joints. In summary, the use of biologics in musculoskeletal conditions can be summarized, but not limited to, joint and cartilage damage, osteochondral lesions and osteoarthritis, non-union fractures, avascular necrosis of the bone during surgery, shoulder osteoarthritis and rotator cuff tears, tendinopathies, viscogenic back pain, knee problems, meniscus tears, and hip problems. Thank you.